1967, our most beloved Madam Zhang Meiling Song founded the first rehabilitation hospital in Taiwan. Located within a park and providing free medical assistance and rehabilitation for thousands of children with poliomyelitis. Now they have grown up, contributing to the society. Madam Zhang's lofty deeds are forever remembered. In order to propagate Madam Zhang's universal great love, under the leadership of the board and successive superintendents, the hospital, along with the passage of time, successfully transformed itself into a general teaching hospital with various departments in 1991, providing the best health care for the public. Since 2004, with the acclaim of the public, Zhenxing General Hospital has successively built health building and second medical building, expanded humanized medical services, and purchased more advanced medical equipment for more forward-looking integrated medical care to ensure the public health. Since its inception, the uninterrupted missions and goals of the hospital have been to build an excellent professional medical team. Only with such persistence and drive can it build for the public a high-quality, standard medical services institution. Zhenxing General Hospital has a renowned international cardiovascular team that is on call 24/7, a team led by Professor Zheng Wei, a reputable authority in cardiac medicine at home and abroad, has successfully completed more than 500 heart transplants. Not only is the success rate the highest in Taiwan, but also among the best in Asia. This is a medical achievement worthy of Taiwan's pride. In addition to the outstanding achievements in clinical medicine, Junction also has excellent performance in teaching and research. Apart from encouraging the development of in-hospital clinical and basic research, it participates in a number of research projects and fosters teaching cooperation and academic exchanges with medical institutions at home and abroad. Concomitantly, it participates in the government's overseas medical aids, contributing to the nation as much as possible. The medical services of the hospital are based on its physician specialties. The key strengths of each department are its broad coverage and integrated capacity. Zhenxing Heart Center was established in September 1994 under the leadership of Dr. Wei. The Heart Center not only has the best cardiologists and cardiac surgeons, but it also works closely with every department in nursing staff, equipment, clinical operations, teaching activities, etc., to provide the best medical services for the patients. Consequently, it attracts many patients at home and abroad and dignitaries from the diplomatic allied nations. To ensure the patients receive the best treatment, our team constantly strives to improve our technology and equipment, acquiring global innovative medical techniques to establish indicators of domestic cardiac medical quality for pushing boundaries in the very discipline. In 1996, the team completed the first case of total artificial heart replacement in the world and then combined heart-kidney transplant. In 1997, the introduction of the techniques of transradial cardiac catheterization greatly reduced the patient's pain. In 1998, the team successfully repaired the left ventricular rupture with the cardiac autotransplantation procedure. In 1999, the team started performing beating heart coronary artery bypass surgery. In 2001, the team completed the world's first case of heart transplantation without blood transfusion on a 2-year-old toddler. In 2003, the team set up the first cardiac rehabilitation center in Taiwan, providing rehabilitation of cardiac functions for patients before and after operation. In 2004, the team successfully completed world record-breaking heart transplantation with prolonged ischemic donor heart for 13 hours. In 2009, the medical team led by Professor Wei successfully invented the vascular ring connector for aortic aneurysm. This invention is also the first implantable cardiovascular medical product developed by Taiwan and approved by US FDA. It provides surgical special materials covered by Taiwan National Health Insurance. In December 2009, Junction launched Taiwan's first and Asia's second hybrid operating room, offering the public the latest and safest medical technology and surgical approach. Our hospital tops the rank in Asia when it comes to survival rate after heart transplantation. To date, there have been 36 patients surviving over 20 years after surgery, with the longest of 28 years the record in Asia. In June 2010, by invitation, Professor Wei led the team to Vietnam to complete the first heart transplant in the country. Since August 2013, thanks to the teamwork of cardiologists and cardiac surgeons, the hospital has performed over 430 cases of transcatheter aortic valve implantation, TAVI. The number of cases and its 99% success rate have both topped the ranks in Asia. Our team has completed more than 12,000 cardiac surgeries and over 30,000 coronary interventions. According to the press release on June 15, 2016 by Taiwan's National Health Insurance Administration, Ministry of Health and Welfare, our hospital's survival rate after heart transplantation is the highest in Taiwan. In addition, Telecare Services Center, consisting of our cardiac team, was established in November 2006. It is the first in Taiwan providing 24-hour real-time remote ECG data transmission and interpretation services to monitor the patient's cardiovascular data for effective health monitoring and management of the patients. Currently, this service is further extended to the monitoring of more chronic diseases concerning blood pressure, blood sugar level, blood lipids, etc., and has won the Symbol of National Quality Award S&Q. Department of Orthopedics, with its early experience in rehabilitation medicine, boasts international medical standards in academic achievements and clinical services. In terms of our lineup of specialists, we have those specializing in general orthopedics, degenerative diseases, knee reconstruction, sports medicine, spinal surgery, hand surgery, pediatric orthopedics, gout, osteoporosis, and so forth for relieving the pain of the patients. In addition to the continuous advancement of medical technology, Department of Orthopedics has developed the intramedullary endo-transilluminating IMET, approved by US FDA in 2017. For neurosurgery, currently we are one of the few medical centers in Taiwan that have full-time neurosurgeons and neuroradiologists under one roof for jointly performing interventional endovascular treatment. On average, we've completed about 500 cases of various neurological operations each year. In September 2015, a state-of-the-art intelligent multifunctional integrated navigation operating room was built. With the powerful computer equipment, the patient's preoperative examination image data are put into the computer to simulate the stereoscopic restructure of the human body, and the locations of the lesions are also marked. The computer navigation function is used in the operation to assist the surgeon in designing a safer, minimally invasive surgical path to remove more accurately the lesions and hence reduce the damage to normal nerve tissues, greatly improving the quality and efficiency of the operation. It provides a more precise and safer, minimally invasive surgical environment for cranial nerves and spinal surgery. Department of Gastroenterology is an important department under Department of Internal Medicine, with many senior attending physicians, from the most basic diagnostic endoscopy, painless endoscopy to professional therapeutic endoscopy, including therapeutic endoscopy for pancreatico-biliary tract, functional examination of the digestive tract, and ultrasonic examination. All can provide the most professional services for patients. Department of Otolaryngology comprises ear, nose, throat, head and neck, surgical, auditory sections, and also voice center. In March 2004, Auditory Medical Center was established. It is the first medical center in Taiwan established for auditory specialty. In the treatments for the hearing impaired, Zhenxing's Department of Otolaryngology has developed the first cochlear implantation. By the minimally invasive implantation surgical techniques, the wound is only about 2 centimeters without need to remove the suture. The patient can be discharged after 1 day of hospitalization, greatly lessening the risks and pains posed to patients and benefiting more. In terms of medical equipment, Zhenxing boasts the suite-style hearing test room with international soundproofing standards, as well as the most advanced auditory function evaluation and diagnostic instruments. All sophisticated equipment is fully merged with humanized design. Adhering to the benevolence of the medical practitioners, Zhenxing has successfully extended its cochlear implantation service to mainland China, Southeast Asia, Canada, New Zealand, etc., with excellent results. In April 2010, Shanghai Mayor Zhenxing came to Taiwan to visit and donate in the name of Honorary Chairman of the Shanghai Red Cross Society for treating children with hearing impairment in the mainland. Zhenxing has spread its love across the strait, taking care of more hearing-impaired children. The techniques in diagnosis and treatment of ophthalmology are becoming more and more sophisticated with the advancement of technology. In terms of treatment methods, we are also on the path to integration and specialization. Our hospital's ophthalmic medical services cover a wide range, especially for the complex treatments of retinopathy and the use of femtosecond laser technology. Thanks to the grand efforts by former Superintendent Liu and Director Xiaoming Zhao in employing the latest technology, eye diseases have been effectively treated. The highest state of health is preventing problems before they occur, and early detection of diseases can render better therapeutic effects outcomes. Junction has established Health Management Center with an aim of providing human-oriented, sophisticated, and effective medical services. In terms of the environment, Health Management Center is located in the separate space on the 11th floor of 2nd Medical Building, which combines the convenience of leisure and quality checkup. The medical team of the hospital boasts specialists from many disciplines for providing a comprehensive and friendly health checkup services. And in terms of equipment, the center fully adopts the 3T MRI, dual-source CT scanner, etc., and other sophisticated equipment providing the highest quality health check. Combining both the strong medical team and the well-equipped hardware, Zhenxing Health Management Center has not only established clear health checkup indicators, but also secured an international standard of health checkup services and quality. The lineup of our specialists under Aesthetic Beauty Clinic includes plastic surgeons, dermatologists, and obesity specialists. Located separately on the 7th floor of Health Building, Aesthetic Beauty Clinic of our hospital has a quiet and elegant environment with privacy and isolation. There are laser room, beauty room, consultation room, hair treatment center, and so on. Tens of millions of dollars was invested in equipment to provide services. We also provide overseas customers with high-quality scarless blepharoptosis surgery, fat grafting, endoscopic breast augmentation, liposuction, and other professional cosmetological services. Junction General Hospital is a legal entity that shoulders the dual responsibilities of societal expectations and business running, so it is professional and sustainable. It is precisely because of this that under the leadership of the successive boards, the Zhenxing Medical Foundation will continue focusing on cultivating highly moral, superbly skilled professionals, providing human-oriented, sophisticated, and highly effective medical services, and establishing a world-class medical institution. Zhenxing shall not waver from its direction, nor stop its efforts in upholding the founding philosophy of Madame Zhang's compassionate heart and dedicated care, and will inherit the spirit of universal relief to fulfill the mission of humane care.